Hi there, my name is Joan and I'm an instructor in the ACCN program. This presentation is part one of 3 review presentations for Module 5. In this first presentation, we will focus on some key definitions regarding adrenergic receptor activation. Catecholamines consist of any group of amines derived from an underlying catechol structure that have important physiological effects as neurotransmitters and hormones. These substances are released as a result of sympathetic nervous system stimulation and can be naturally occurring, either endogenous or synthetic, exogenous. Adrenergic receptors are protein structures found in the sympathetic nervous system that normally bind with catecholamines, preparing the body for fight or flight. The main agents within the system are norepinephrine and epinephrine. As you can see from the diagram, the sympathetic nervous system innervates many body systems, including the eyes, salivary glands, heart, lungs, GI tract, liver, pancreas, kidneys, particularly the adrenal glands, bladder, and reproductive organs. The other branch of the autonomic nervous system is the parasympathetic nervous system. The nerve fibers in this system release acetylcholine when stimulated. This picture shows both parasympathetic and sympathetic innervation, and you can see how the majority of the the parasympathetic nervous system nerves branch off from the cervical area of the spinal cord, the cranial nerves, whereas the sympathetic nervous system nerves branch off from the thoracic and lumbar spinal nerves. An agonist is any agent that interacts with the receptor and causes a positive response. An antagonist blocks the receptor from being stimulated. Chronotropic relates to the heart rate. Any drug that has positive chronotropic effects will increase the heart rate, whereas a negative chronotropic effect would reduce the heart rate. For example, epinephrine would be called a positive chronotropic medication, whereas a beta blocker such as metoprolol would be a negative chronotropic medication. Dromotropic refers to the atrioventricular conduction velocity. A positive dromotrope would increase the AV node conduction, and a negative dromotrope would slow the rate of conduction. Inotropic refers to the contractility of the heart. This is independent of the left ventricular end diastolic pressure or preload and reflects the heart's inherent ability to contract. An example of a positive inotrope would be digoxin, which increases contraction via increasing intracellular calcium. A negative inotrope would be a beta blocker, such as metoprolol. Lusitropy is the ability of the cardiac muscle to relax. The more the ventricle can relax during diastole, the greater filling can occur, which increases myocardial muscle cell stretch, increasing the contractility and stroke volume. An example of a drug that has positive lusitropic effects is milrinone. A vasopressor is a medication that causes vasoconstriction and increases systemic vascular resistance, and its effect usually results in an increase in blood pressure and cardiac output. It is important to keep in mind that increasing systemic vascular resistance also increases the workload of the heart, and in some circumstances can impair forward flow of the blood so significantly that the cardiac output will drop. This concludes the first review presentation on definitions related to adrenergic receptor activation. If you have any questions, please contact your instructor.